Hey everyone, Dr. Luke Peterson here, physical therapist with the Knee Replacement Therapists. I wanted to talk a little bit about foam rolling. It's something that's very common and I see it a lot and I see a lot of questions about it. And I just want to talk about how I use foam rolling in the clinic with patients who are either planning and preparing for knee replacement surgery or recovering and rehabbing after surgery. So, the first thing I want to talk about is the mechanisms behind foam rolling and the benefits that you might experience with foam rolling. A lot of people like to think, and it's kind of prevalent, that when you foam roll, what you're doing is you're massaging all those muscles and the fascia and the scar tissue, and you're breaking up these adhesions and this scar tissue. And by doing that, you're making the tissue more malleable, more pliable, and move better, and you're increasing the length and the flexibility of everything. Seems like that would make sense, but unfortunately, if you look at the amount of force, so the mechanical force that's needed to actually break up adhesions and break up adhesions between the fascia and the muscle and to actually lengthen a muscle or a tendon, it's a tremendous amount of force. Um, you know, very, very tremendous amount of force that is the force that you're able to apply with a foam roller and yourself is a fraction of a percentage of the amount of force that you need to do that from a mechanical perspective. So it begs the question, well, I foam roll and I feel a lot looser and my flexibility seems to improve. So what's going on? Well, what's going on is more likely a neurological change. So what's happening is we have this tone in our body, or you might think of it as the amount of tightness in your muscles, different muscles, and there's this resting amount of tone. And what happens when you do foam rolling is you're sending these signals and inputs to all of the sensory nerves that are in that muscle and around that muscle, and that those nerves are communicating with your central nervous system and your brain. And what happens is that actually helps to cause a decrease in your neural tone. So it's like your perception essentially of the stiffness in the muscles and the perception of the tightness has actually decreased after you foam roll because that neural tone has kind of been unlocked, so to speak. Now, the benefits and this improved flexibility and range of motion that you experience is very transient. It can only last for a short amount of time. So, if you foam roll one day and you notice improved flexibility, improved range of motion, you're most likely not going to experience that improved range of motion the next day after unless you're going to foam roll again or do another technique. So what I like to do in the clinic with individuals with knee replacement is if they're able to, have them do some foam rolling for basically just a couple minutes at the beginning of their session. And then what that does is that decreases some of that neural tone, decreases some of that perception of pain and stiffness and discomfort. And ideally, that will help us when we go and do some of our range of motion exercises and our strengthening exercises. They're going to have some better tolerance and they're going to get a little bit better motion and have a little better ability with that. So that's the main reason and the main way I use it. I do run into trouble with sometimes getting into the certain positions for foam rolling for your glutes and your hamstrings and your thighs. It's kind of these positions that are definitely difficult for some people to get into those positions. So maybe I won't use the foam roller. Maybe I'll try getting them up on the therapy table and then using the foam roller there. Or what I might do is something different to provide a little bit of that decrease in tone. Maybe something like a massage stick, maybe a lacrosse ball, maybe just some, active stretching and movement in itself is very beneficial. I really like to use foam rolling and things like self-massage as more of an adjunct. It's not going to be the main focus of my treatment or what I'm doing. It's basically something to warm those muscles up a little bit, decrease some of that perception of stiffness and tightness so that the person then can tolerate the stuff that we want to do, the range of motion exercises, the strengthening exercises, the functional movements, and things like that. So that's how I like to use foam rolling in my clinic and with my patients that I work with who are either planning or preparing for knee replacement or recovering afterwards. Again, it's kind of an adjunct, kind of something that is a little bit of an assist before we do the main bulk of our treatments, but definitely has some benefits, and it's just a matter of keeping it in perspective of you're not necessarily by any means breaking up adhesions, you're not breaking up scar tissue, you're not lengthening and stretching out your muscles, you're more changing that perception of tightness, that neural tone. And so it's kind of a short-term benefit that we'll take advantage of, but unfortunately it doesn't necessarily make this long-term change. At least we haven't found that yet. Hopefully that provides some helpful information. If you have any feedback or comments, or any of you fitness or health professionals who can tell me what I said wrong and I can correct myself, I'm all for it. Thank you very much for watching, everyone, and take care.